fibula. So this bone is fibula. You can see this is fibula of right side. Okay. So fibula is the lateral bone of the leg and it is homologous with the ulna of the forearm. Okay. It is homologous with the ulna of the forearm. And in Latin, the term fibula means pin. Okay, fibula means pin. You can see it's a very thin and long bone like the pin. Hence, the lateral bone of leg is rightly named fibula because it is a long pin-like bone. And it is a long, slender, postaxial bone of the leg and it does not take part in the transmission of the body weight. Body weight is mainly carried by the tibia, okay, through the ankle, through the foot. So it serves two important functions. What are the functions of fibula? It provides attachment to the muscles. Okay, muscle attachment is there, and its lower end, along with the lower end of tibia, forms the socket tibiofibular mortise to hold the talus in position, forming the ankle joint. We have already seen. See here, this one is fibula, here is tibia. Tibia is medial bone, fibula is the lateral bone, okay. And see, this is head of fibula which is articulating with the lateral condyle of the tibia forming superior tibiofibular joint, that is plain synovial joint. This is middle tibiofibular joint formed by this interosseous membrane which is syndesmosis or fibrous joint. And this is inferior tibiofibular joint or distal tibiofibular joint formed by the lower end of tibia and lower end of fibula. Okay, this is also syndesmosis or fibrous joint formed by the interosseous tibiofibular ligament. So these are the three joints we have already discussed. So this is lateral bone, you remember, and corresponds with ulna of the upper limb. Okay, that is also asked in your viva table. Corresponds to which bone of the upper limb. So what will be the presenting parts of the fibula? Fibula is a long bone, presents three parts: upper end, lower end, and the intervening shaft. You can see here, this is upper end, lower end, and the intervening shaft. So upper end or head is round and presents a circular articular facet. See, this is the head, it is rounded and presents a circular facet which articulates with lateral condyle of tibia. And an upward projection posterolateral to this facet, that is called styloid process. You can see this projection. This is styloid process of the fibula and it is located posterolaterally. Okay. This will be the anatomical position. It is located posterolaterally. And the shaft is described to have three borders and three surfaces. What are the borders? Borders are anterior border, interosseous border, and posterior border. And three surfaces are medial surface, lateral surface, posterior surface. Okay, three borders and three surfaces. However, only interosseous border is very clear cut and other borders and surfaces spiral, so that it is difficult to ascertain the borders. Okay, and none of them remain in position implied by their name. Okay, some rotation of these borders and surfaces are occurring near the lower part. The lower end is flattened and bears a triangular articular facet on its medial surface for articulation with the talus. Okay, so you can see lower end is flattened and this triangular articular facet, it articulates with the talus. Okay, lateral surface of talus. And behind and below this is a roughened fossa, that is malleolar fossa. Here, this is the malleolar fossa. This is behind and below this triangular facet. So how will you hold it in anatomical position? Head will be above, head and styloid process is above. Interosseous border is facing medially, sharp border, and this malleolar fossa is below and behind this triangular facet. So you hold it like this. This will be the anatomical position of fibula. So everyone will determine the side of their own bone. Okay, যার যার কাছে bones আছে side determination কর and hold it in anatomical position. Okay, so you hold it like this with your thumb and index finger of the same side. okay, to which side it belongs. Hold it like this. You hold this in anatomical position. Which sided fibula is this? Yes, this is left side. So we hold it with left hand. Okay, like this. Okay, okay, sit down. So these are the presenting parts we will discuss in details. Okay, first head of the fibula. This part is head. Okay, head is a small knob-like extension. You can see small. Don't talk among yourselves. Silence, everyone. So head is a small knob-like extension from the proximal end of the fibula and that articulates with the lateral condyle of the tibia. Head is an attachment site for the soleus, biceps femoris, fibularis longus, that is peroneus longus, and extensor digitorum longus muscle and the fibular collateral ligament. Okay, so all these structures, muscles and ligaments are attached over the head of the fibula. Okay, next we are going to shaft of the fibula or body. It is the elongated midsection of the bone. The elongated part, this is the body. An interosseous border or margin. This is interosseous border. This is very sharp border. It is the sharp edged medial margin of the fibula and that serves as the attachment site for the interosseous membrane. You have seen in the picture, and which binds the fibula to the tibia. Next is lateral malleolus. This projecting part at the lower end is the lateral malleolus. Okay, lateral malleolus is a pyramidal shaped downward projection from the distal end of the fibula, and lateral malleolus, which extends more inferiorly than the medial malleolus, articulates with the tibia and the talus bones of the foot to form the lateral portion of the ankle joint. Okay, this triangular facet with articulate with the talus and the rough area above the triangular facet, this area articulates with the tibia, okay, via the interosseous tibiofibular ligament forming inferior tibiofibular joint. Okay, so several ligaments attach the lateral malleolus to the tibia, talus and the calcanea bone. We have already seen the ligaments during the foot joints of the foot we have discussed in the morning. Next we are going to different borders and surfaces. Okay, head we already discussed. The constriction just below the head is connecting it with the shaft. Okay, and this narrow part just beneath the head is the neck, and the common peroneal nerve is related to the posterolateral aspect of the neck and the anterior tibial artery on its medial aspect. So this relations of neck is important because neck fracture is very common and it will injure the common peroneal nerve and there will be foot drop. Okay, so posterolateral aspect of neck is related to common peroneal nerve. Okay, where it is dividing into two nerves, superficial and deep peroneal nerves, and anteriorly and anterior tibial artery on its medial aspect it is related, where there is gap in the upper part of interosseous membrane. Okay, next shaft has three borders and three surfaces: anterior, posterior, medial border, and three surfaces are medial, lateral and posterior surface. We'll see the extent of the borders. First is anterior border. It provides attachment to the anterior intermuscular septum. See, this is cross section through the fibula. Okay, this is anterior border, here is posterior border, and this one is medial border or interosseous border. This surface is the medial surface, here is the posterior surface, here is lateral surface. Okay, in between the three borders, and you can see this posterior surface is divided into two parts, medial part and lateral part, by a very prominent crest. Okay, this is not border, this is median crest. Okay, and it is dividing the muscle attachments. Okay, medial to this crest only tibialis posterior is attached, lateral to the crest two muscles are attached. We will discuss. Okay, so anterior border provides attachment to anterior intermuscular septum, here anterior border, and of the leg in the upper 3/4. It begins just below the anterior aspect of the head and inferiorly it splits to enclose a triangular area which continues on the lateral surface of the lateral malleolus. Okay, so this is anatomical position of fibula. So here you can see from anterior surface of the head it is extending downward. Okay, so here it is extending downward and it is extending up to the this triangular area. Okay, so this is anterior border of the fibula, this one. Okay, anterior border, and this is the triangular area at the lower end. This border is extending up to the apex of the triangular area. Okay, which is extending on the lateral surface of lateral malleolus. Okay, so this from the anterior part of the head extending downward up to this apex of the triangular area which is extending on the lateral surface. So this is anterior border. Okay, next we are going to the and the superior extensor retinaculum is attached to the anterior margin of triangular area here. Superior extensor retinaculum. Okay, and superior peroneal retinaculum attached to the posterior margin of the triangular area here. Superior peroneal retinaculum. Okay, so three retinaculums are there, three compartments of leg are there. One is extensor retinaculum in front, flexor retinaculum behind, and laterally peroneal retinaculum. Okay, so these two retinaculum are attached at two margins, anteriorly extensor and laterally or posterior along the posterior margin peroneal retinaculum. Next we are going to posterior border. It extends from posterior aspect of the head to the lateral margin of the groove on the posterior surface of the lateral malleolus. Okay, so see here, this is the groove on the posterior surface of lateral malleolus. So this border is the posterior border. Okay, extends from posterior aspect of head up to the lateral margin of this groove on the lateral malleolus. Okay, so this is posterior border, and posterior intermuscular septum of the leg is attached to its upper tripod. Okay, so mainly intermuscular septums, these are parts of extension of deep fossa that is attached at these two borders. Next is interosseous or medial border. This sharp border you can see that is medially placed and this is medial border. Okay, so interosseous or medial border, it lies close and just medial to the anterior border. Okay, you can see this is anterior border and this is the sharp interosseous border. They are very close to each other. The distance is only 3 millimeter in the upper part here. Okay, very thin board surface is here, that is medial surface. Okay, so it lies close and medial to the just medial to the anterior border, separated from it only by 3 millimeter in the upper part, and inferiorly it ends at the upper end of roughened area for the interosseous membrane. You can see here this border is extending up to this roughened area for the interosseous membrane where there is formation of inferior tibiofibular joint. So this is interosseous border, and interosseous membrane is attached along its whole length except at its upper end to leave a gap for the passage of anterior tibial vessels. Okay, the upper end of interosseous membrane, there is a gap for passage of anterior tibial vessels coming from posterior to anterior. Next we are going to the surfaces. We have discussed the extent of the borders. During bones viva you will be asked about these borders and surfaces. Okay, you remember those extent. Next is surfaces. First is medial or extensor surface, that is lying between the anterior border and the medial border or interosseous border. Okay, very narrow. It is a narrow, lies between the anterior border and interosseous border. Gives origin to extensor digitorum longus in the upper 3/4 here. This is medial surface, extensor digitorum longus. The pink colored one is extensor digitorum longus from the upper 3/4 whole extent of its upper 1/4 and anterior half of its middle 2/4. An extensor hallucis longus, dotted area is extensor hallucis longus, arises from the posterior half of the middle 2/4, medial to the extensor digitorum longus, and from whole extent of the lower 1/4. Lower 1/4 provides origin to peroneus tertius. Okay, so three muscles are attached over this medial surface: extensor digitorum longus, upper 3/4, extensor hallucis longus, middle 2/4, and peroneus tertius, lower 1/4. Okay, remember it. Next, lateral or peroneal surface. This one is lateral surface. Lateral surface lies between the anterior border and posterior border. Okay, anterior border and posterior border. Here is the lateral surface. Okay, in the lower part it is twisted towards the posterior aspect. So lateral surface lies between these two borders. Peroneus longus arises from the upper 2/3. Okay, you can see the pink one is the peroneus longus and this shaded area is the peroneus brevis. Upper 2/3 peroneus longus and lower 2/3 peroneus brevis, and here they are overlapping with each other. So peroneus longus arises from upper 2/3, whole width of upper 1/3 and posterior half of the middle 1/3, and peroneus brevis arises from anterior half of its middle 1/3 and whole width of the lower 1/3. Okay, so this is lateral surface. Next is posterior or flexus surface. This one is posterior or flexus surface. It is extensive and lies between the interosseous and posterior border. You can see this is interosseous border and here is the posterior border. Okay, so in between this whole surface is the posterior surface, and this prominent ridge is the median crest. Okay, it is dividing the posterior surface into medial part and lateral part. Okay, so it is extensive, lies between the interosseous and posterior border. Its upper 2/3 is divided into medial, concave and flattened lateral areas. Okay, medial part is concave, okay, and separated by a sharp vertical ridge, that is medial crest, and fossa covering the tibialis posterior is attached to the medial crest. Okay, so this is attachment of medial crest, and medial concave part gives origin to tibialis posterior. You can see this is medial crest dividing the posterior surface into two halves. This medial area gives attachment to tibialis posterior, and medial crest gives attachment to fossa covering tibialis posterior, and the lateral area gives attachment to, in the upper part, soleus and lower part flexor hallucis longus. Okay, and in this surface nutrient foramen is located. Okay, so medial concave part gives origin to tibialis posterior, lateral flattened part gives origin to the soleus in the upper 1/4 and to the flexor hallucis longus in the lower 3/4, and peroneal artery descends along the medial crest, and nutrient artery of this bone, fibula, is a branch from this peroneal artery and enters the nutrient foramen present just above the middle of the posterior surface, and nutrient canal is directed downward. Okay, so upper end will be the growing end for the fibula. Next we are going to lower end. Lower end of fibula is expanded part and expanded anteroposteriorly to form lateral malleolus. You can see this projection. Very important, it is important for your surface marking. You have to identify tip of the lateral malleolus, tip of the medial malleolus during the surface marking. Okay, so and which presents four surfaces: anterior, posterior, medial and lateral. Anterior, posterior, medial and lateral. Okay, so anterior surface is rough and round and provides attachment to the anterior talofibular ligament. A notch at its lower border provides attachment to the calcaneofibular ligament. Here you can see this anterior surface rounded and notch below gives attachment to this ligaments. Next is posterior surface presents a groove which lodges the tendons of peroneus brevis and peroneus longus, and longus being superficial to the brevis. Okay, so this is the groove on the posterior surface which gives passage to the two tendons, peroneal muscles. Peroneus longus superficially, peroneus brevis at a deeper plane. Next, medial surface. Here is the medial surface. It presents a triangular facet, articular surface in front and a depression, that is malleolar fossa below and behind it. Okay, so this is the triangular facet taking part formation of ankle joint articulate with talus, and this is the malleolar fossa below and behind this triangular facet. In this will be the anatomical position. Here is triangular facet, below and behind it will be the malleolar fossa. One of the point for side determination. Okay, so this in so medial surface presents triangular articular facet in front and a depression malleolar fossa below and behind it. Upper part of the malleolar fossa provides attachment to the posterior tibiofibular ligament and its lower part to the posterior talofibular ligament. Okay, this attachment is important. It is asked in your viva. What is the attachment of malleolar fossa? Okay, and lateral surface is triangular and subcutaneous. You can see this triangular area is located laterally. It is subcutaneous and triangular. So lower end is done. So this is the attachment of muscle of different surface. Medial surface, extensor. This is extensor surface, medial surface. Okay, extensor digitorum longus, extensor hallucis longus, and peroneus tertius. This lateral surface, peroneus longus, peroneus brevis. Posterior surface divided by median crest into medial part and lateral part. Medial part gives attachment to origin of tibialis posterior. Lateral part, upper 1/4 soleus, lower 3/4 flexor hallucis longus. Okay, so this diagram you remember for muscle attachment. Okay, and this is lower end. You can see this is triangular facet for articulates with talus, and here is the malleolar fossa below and behind this facet. Here is attachment of two ligaments in the fossa, posterior tibiofibular ligament, posterior talofibular ligament in the malleolar fossa. And here is attachment of other ligaments, anterior talofibular, calcaneofibular, and there is interosseous ligament connecting the tibia and fibula. This is the rough area which is taking part in formation of the inferior tibiofibular joint, syndesmosis. Okay. Okay, so this is fibula tibia. Okay, so attachment you can see this is median crest. This is posterior view from the back. Posterior surface is shown. Median crest, medial part of the posterior surface, tibialis posterior, and rest of the part soleus and flexor hallucis longus. Okay, and this is anterior view. This is lateral surface, peroneus longus, peroneus brevis, and this is anterior surface, not anterior, medial surface. Medial surface gives attachment to extensor group of muscles, extensor digitorum longus, extensor hallucis longus, and peroneus tertius. Okay, and you can see this is interosseous membrane connecting these two bones. Upper end of interosseous membrane, there is a gap for passage of anterior tibial artery, and the neck is related to this nerve, common peroneal nerve, and it is dividing into two branches here, deep peroneal and superficial peroneal. And head, there is attachment of this ligament, arcuate ligament, and there is facet for articulation with tibia, and here is attachment, insertion of the biceps femoris, C separate insertion of the biceps femoris muscle. Okay, hamstring group of muscles, biceps femoris, and this is cross section through the tibia and fibula connected by interosseous membrane, anterior border, posterior border, interosseous border, medial surface, lateral surface, posterior surface, divided by medial crest into medial half and lateral half. Okay, and here is the attachment of anterior intermuscular septum along the anterior border, posterior intermuscular septum along the posterior border. Okay, so what will be the anatomical position and side determination? Side of the fibula can be determined by holding it vertically in such a way that it is rounded end, called head is directed upward. Head is directed upward, and it is relatively flattened end is directed downward. This lateral malleolus, this is flattened anteroposteriorly. So this is directed downward. And a triangular articular facet at its lower end faces medially. Triangular facet faces medially at the lower end, and a depression at the lower end, malleolar fossa, lies behind and below the triangular articular facet at this lower end. Okay, so this will be the anatomical position. Okay, head is directed above and below is down determined, and lateral malleolus is below. Triangular facet is medially, and this malleolar fossa is below and behind the facet, triangular facet. Okay, so anterior posterior is determined by this malleolar fossa will be behind, below and behind. Okay, medial lateral, this triangular facet will be medial. Okay, and above and below determined by head is above, lateral malleolus is below. Okay, understood? So this will be the anatomical position of fibula. This is fibula of right side. Okay, understood? And you will also be asked the articulation. Articulation you can see here. Upper end articulates with lateral condyle of tibia. Here is a circular facet you can see forming superior tibiofibular joint. And at the lower end it will articulate like this. Okay, triangular rough area articulates with this area of tibia, form fibular notch of tibula and forming inferior tibiofibular joint, and two interosseous borders are connected forming middle tibiofibular joint. Okay, so this will be the articulation, and it will also articulate with the foot like this, forming the tibiofibular mortis at the lower end, forming ankle joint, articulate with talus only. Okay. Okay. Next, we are going to ossification of fibula. Ossification of fibula is very important. Comes one explain why question from here. Okay, you must remember. So fibula ossifies from three centers: one primary center for the shaft and two secondary centers for the two ends. So primary center appears in the midline of the shaft at the age of 8th week of intrauterine life. Secondary center for the upper end appears at 3 to 4 years and fuses with the shaft at 20 years. And for the lower end, appearance at 1 to 2 years and fusion with the shaft at 18 years. And you can see here the upper end center appears last and unites last, and this lower end appears first, unite first. And this is a controversy towards the law of ossification. According to law of ossification, the center appears first, unite last, but here opposite is occurring. Okay. So in fibula, law of union of epiphysis is violated, and according to this law, epiphyseal or secondary center which appears first unite last with the diaphysis. But in fibula, epiphyseal center for lower end appears first and also unites first. For what will be the explanation for this? The explanation to this violation is that epiphyseal center in the lower end of fibula appears early because it is a pressure epiphysis. Okay, it is carrying some amount of body weight, and as the growing end of fibula is its upper end, so it unites with the diaphysis last, as evidenced by direction of nutrient foramen. So upper end is growing end and it is unites with the diaphysis last, although its epiphyseal center appears also last. Okay, so that's why there is violation of the rule of epiphysis. Next, what are the clinical aspects of fibula? Bone grafts. Bone grafts, this is also comes as a explained why fibula is a common site for bone graft. Okay, as fibula does not take part in transmission of body weight, and that's why it is a common source of bone graft and easily accessible in the leg, laterally placed. Okay, and fibular fracture. Fibula is commonly fractured 2 to 5 centimeter proximal to the distal end, most common site of fracture of the lateral malleolus, and it is often associated with fracture and dislocation of the ankle joint. Okay. Okay, that's all. Any queries from this topic? So you prepare fibula for bones viva, its presenting parts, muscle attachment, borders, surfaces, all these are asked. malleolar fossa attachment is important, and side determination, anatomical position, and this you prepare for theory, explain why. Okay, why there is violation of rule of epiphysis at the lower end of fibula. Okay, so this is exception in many of the cases. Okay, and bone graft also comes in your explain why. Okay, any queries? So everyone will be able to hold the bone in anatomical position, yes or no? Yes, those who have bone, show me how will you hold. দেখা যাদের যাদের কাছে বোনস আছে, তুই এদিক থেকে শুরু কর, ইউ স্ট্যান্ড আপ অ্যান্ড শো মি দ্য অ্যানাটমিক্যাল পজিশন. Which sided fibula is this? Left. So hold it properly. How I have told it? Hold it with the left hand. Yes, like this. That will be the anatomical position. Show me the styloid process. This one. Head. An articular facet for tibia. Tibia. Upper end. Okay. Next person. Stand up. কার কাছে আছে বোনস? দাঁড়াচ্ছিস না কেন? দাঁড়া উঠে। Hold it in anatomical position. Which sided fibula is this? Right sided. Show me the malleolar fossa. Yes, and this triangular facet articulates with which bone? এতক্ষণ ধরে 1000 বার বলা হয়ে গেছে মিনিমাম. হ্যাঁ, articulates with tibia, articulates with talus. Tibiofibula mortis form করছে তো. Okay, next person stand up. আর কার কাছে বোনস আছে? দাঁড়া, পিছনের জন দাঁড়া. রেড বোনস আছে, ওর কাছ থেকে নিয়ে নে বোনটা. Okay, so hold it in anatomical position. Which sided bone is this? Huh? So how will you hold it? কিভাবে বলেছিলাম? With thumb and index finger. এতবার দেখানোর পরেও যদি অ্যানাটমিক্যাল পজিশনে না পারিস তাহলে তো জিরোই পাবি, কিছু করার নেই. Hold it properly in anatomical position. If you don't understand, you have to ask. ঠিক করে ধরেছে দেখ তো, উল্টো পাল্টা ঘুরিয়ে ধরেছিস মনে হচ্ছে তো. malleolar fossa below and behind the facet রেখেছিস. ওকে, ঠিক আছে, হোল্ড ইট প্রপারলি. ওকে, সিট ডাউন. বর্ডার্স দেখাতে পারবি? হ্যাঁ কি না? পারবি না? নেক্সট জন. Yes, hold it like this. This will be the anatomical position. Okay, this is styloid process. So show me the borders. What are the name the borders first? Anterior border. Okay, from anterior part of the head up to this triangular area. Okay, anterior border. Next you show the posterior border. Yes, posterior. Which one is posterior? This one. Okay, posterior part of head to the groove, lateral border of the groove on the posterior surface. আর হচ্ছে medial border দেখা, medial or interosseous sharp border. Okay, so 3 borders are done. Next you show the surfaces.
Anterior border and medial border মাঝখানে medial surface.
Okay,
and medial border and posterior border মাঝখানে হলো
posterior surface. আর median crest টা দেখিয়ে দে.
median crest টা
this one, this prominent one, median crest. এইটা posterior border যাচ্ছে. Okay, so median crest. Next another surface is
medial, posterior and
lateral surface. Okay, lateral surface এ কি কি মাসেল ছিল বলতো? laterally কি কি ছিল? peroneus muscles, longus and brevis. Okay, ঠিক আছে, প্রিপেয়ার কর ভালো করে ফিবুলা. আজকে গিয়ে সবাই ফিবুলা পড়বি, নাহলে সব ভুলে যাবি. Okay, any queries from this?